Welcome to Functional Medicine with Dr. Var. This podcast is to help you explore the underlying root causes of your chronic symptoms and health challenges, reset your health, and reclaim your life. I'm so excited to be here with you today. Let's get to the first episode. I've been a family medicine physician for over 20 years, and I am seeing alarming trends in medicine. I'm seeing people getting sicker and sicker at a younger age, even though we have more and more medicines and medical interventions. When I first started, there was maybe about 20% of patients on 5 or more medicines, and now I feel like that's more of the norm instead of the exception. I actually looked up the numbers because I was like, is it just my population or is this true across the nation? Back in the early 2000s, about 23% of adults over the age of 65 were on 5 or more medicines. And by 2025, that doubled to 42%. Now, under the age of 65, it was about 8.2% back in the early 2000s. And the last set of data that I could see was in 2018, and it doubled to about 16%. It's been 7 years since then, so I can only imagine what the percentage is now. But when you're on 5 or more medicines, we call that polypharmacy. Polypharmacy can put you at risk for major complications and even death. Number one, from the medications itself, adverse drug reactions are one of the leading causes of death. You also can have side effects to the medications that can cause sedation, falls, and other adverse effects. Polypharmacy is a symptom of a much bigger problem, that more and more people are getting sick and having chronic conditions at a younger age. We're seeing diabetes in teenagers now or even younger. I'm seeing anxiety, depression in 1 out of every 5 teenager. ADHD. Almost everybody has some sort of stomach issue and is either on an acid reducer, nausea medicine, or IBS medicine. Now, let me be clear. I'm not anti-medication. I'm actually grateful for medications because it does save lives, and it's great for acute symptoms, and it's great for preventing acute flares of chronic conditions. But I feel like it shouldn't be the end-all, be-all, and it shouldn't be, okay, you're on medicine, you have this condition, you have it for the rest of your life, and one and done. But there should be more questions that are asked, like, why is this happening? Why are we getting sicker and sicker as a population? And to be fair, I think there are a lot of healthcare providers that are asking that question, and hence why I think there is a greater interest from healthcare providers looking into functional medicine and integrative medicine, where back in the day it might have been considered woo-woo, but now there's the American College of Lifestyle Medicine that's been there for many years, but they use some phrase words that have been used in functional medicine, looking at the underlying root cause through primarily lifestyle, which are nutrition, sleep, movement, stress management, and connection. So these are things that functional and integrative medicine have been focusing on. And so it's so great to now have a specific board certification within the conventional medicine framework that does focus on that. In fact, they even say that they look at the lifestyle to try to help make changes that can reverse and prevent chronic disease. Whereas before, it was just once you had a chronic disease, that was it. And I'm actually going through their program now, and hopefully we'll get a certification from them, because I feel like there's no one perfect mode of medicine, even functional medicine, integrated medicine. There are some limitations with that, and perhaps I'll do a video comparing the strengths and benefits of each medicine model. But I just want to have all the tools I can have so I can better take care of my patients, provide education for you, so you can take this information to your doctor, and hopefully they'll get interested in looking at other ways and options and getting these additional tools to help their patients. But I'm trying to figure out what I can do to help people heal, because I didn't get into medicine just so I can write prescriptions and just constantly put Band-Aids on people. I got into medicine because I wanted to serve and I wanted to heal and help people. And most healthcare providers don't want to write more prescriptions. They want to try to do well for their patients. Most healthcare providers have good intentions, and them writing you a prescription is not a bad thing, but we need to try to have more of the culture that this shouldn't be the norm and it should be more of the exception. This is one of the reasons why I was very interested in functional medicine because functional medicine helps to look for the underlying root causes of chronic disease. So when you get a diagnosis and you're prescribed something, we don't just stop there. We ask, why do you have this? And what is going awry in your body as a whole that could be causing this? It's given me tools to look deeper into why somebody might be out of balance. And more importantly, what can I do to help them feel better and possibly have a chance of not being on a ton of medicines. And by the way, we don't want them on a ton of supplements either. We might use supplements to help people come into balance. And of course, there are some supplements that might be beneficial to take lifelong just for general health. But overall, we don't want you to be on 20 supplements either. I realize that many healthcare providers have a lot of misconceptions about functional medicine, and also many patients don't know what functional medicine is and don't realize that there are options to help them feel better. Let's break down what functional medicine is and how we go about assessing you if you were to come in for a functional medicine visit. So when you come in for your first visit, usually as a functional medicine provider, we like to get the story of your life to see what types of events or triggers that could have led to your chronic symptoms or chronic disease. We may even ask about your birth history, like if you were born vaginally or by C-section, because that can affect your microbiome. If you were on a lot of antibiotics as a kid, because that also can affect your microbiome. If there are any major illnesses or surgeries, if you had a lot of trauma or even little T traumas growing up, if you felt like you had to walk on eggshells all the time and always in defensive mode, that can be a very big stress, and that can affect you whether you realize that or not. How was your adolescent years? How was your 20s and 30s? And if you're in a relationship, and what things are like. Then we look at your lifestyle. What's your diet like? Exercise like? What's your stress level? How are you sleeping? And what are your connections? Because all of those are very important in how you feel and how chronic symptoms or chronic disease may manifest because of imbalances if you have a not so great lifestyle. Sometimes I will have patients complete a head to toe symptom questionnaire and a food journal to see what their nutrition is like and what symptoms are really bothering them and to what degree. Now, I work within a conventional medicine framework, and I'm very lucky because the hospital network that I work for have been very open and allowing me to have 40 minutes for patients, which is usually it's like 15 or 20 minutes for like even follow-ups. They've been very open to me practicing functional medicines, but there are a lot of hospital networks that still they focus on their providers being productive, which mine does, don't get me wrong, but they are better than most, and I'm very grateful. But if you go to a functional medicine provider that is not constrained within a conventional medicine framework, if they have their own practice, they may spend up to 2 hours with you just getting your whole history and really help develop a plan. So we just try to get a good history of what your life is like and get to know you as a person and get to know what things may have contributed to how you are feeling now. And maybe some things that you haven't dealt with. Like if you haven't dealt with trauma, then that is definitely something that you may need to resolve because trauma will show up as some sort of chronic symptom or chronic disease elsewhere in the body. I mean, I can't even tell you how many patients, unfortunately, where their spouse may pass away and they end up getting cancer like 1 or 2 years later. And I just kind of wonder, is it because of the grief is so hard on their body and that trauma is so great and it's hard to process? So there's so many things that can affect us, and trauma and stress, I would say, is like one of the biggest contributors, and we don't really often ask about that in conventional medicine. In functional medicine, we look at 6 core pillars, and these aren't in any particular order, but number 1 is gut health. Number 2, mitochondrial health. Number 3, toxin exposure and detoxification. Number 4, your immune system and inflammation. Number 5, cardiometabolic system. And number 6, hormones. We also look at structural integrity, which is your muscles and joints, and then also your mental, psychological, and spiritual health too. I'm going to go over each of these pillars to give you an idea of what types of things we look for. In gut health, we look at digestion. How well are you digesting your food? Because digestion is how your body starts extracting your nutrients that you need for many of the processes in your body to run. If you're not even able to digest your foods properly, you're not going to get those vital nutrients that you need, setting you up for possible vitamin deficiencies and other symptoms because other processes in your body can't run because they need certain vitamins and minerals to move forward. We also look to see if there's a lot of inflammation in your gut. 70% of your immune system is in your gut. So if you have a lot of inflammation, you're going to be setting off your immune system and creating all these inflammatory cells that can seed elsewhere in the body and cause inflammation in your joints, in your brain, on your skin. So some people have gut health issues and may not have gut symptoms, but if they have skin rashes, brain fog, joint pains, then we definitely will still look into your gut because the gut can cause that. We also look at your gut microbiome. Do you have more good bacteria than bad bacteria in your gut microbiome? These good bacteria produce substances that can be very beneficial for your body, such as a short-chain fatty acid. And those short-chain fatty acids play a part in regulating your weight, regulating your moods, and also reducing inflammation in your gut. We also look to see if there's infections. I have had patients where we did the standard conventional medicine stool test. They had the $1 million workup with the colonoscopy and upper GI and was just told they had IBS. From a functional medicine standpoint, we looked for other infections and found that they had something called small intestinal bacterial overgrowth and got treated and started them on a particular diet short term, and they were feeling better and we're just starting to rebalance their gut. And then we look at how your gut affects your moods. You have something called the gut-brain axis, which is how your gut and brain communicate. And they communicate via something called the vagus nerve, which is basically a nerve that goes from your gut, innervate all your organs and goes to the gut. And so your gut can have a role on how you feel if it's not communicating well with your brain. Number 2, mitochondrial function. Mitochondria are your little energy producers of each cell. So really important that they are healthy because they take your breakdown products of your food, your proteins, fats, and carbohydrates, and they convert it into energy. So if they don't have everything that they need, which they rely on a lot of different vitamins and minerals to run, or if they are damaged because you have been exposed to certain toxins or you eat a lot of sugar, then you're not going to make enough energy. So you're going to feel tired. You also may not have enough energy to run other processes in your body. And so you can end up with other symptoms. It is very important that your mitochondria have what it needs to run efficiently. Number 3 is toxins and how well are you detoxifying? We're exposed to thousands of toxins a day from our food, water, environment, and you can't avoid it 100%, but we want to make sure that we're detoxifying well because these chemicals, like I mentioned, can damage our mitochondria. This can cause other problems such as cancers, obesity, cognitive disorders. So looking to see what your toxic burden is something that's very important. We also want to look at detoxification because everybody's different. Some people can be exposed to a lot of toxins, but because they detoxify well, it's not as detrimental as to someone who's not detoxifying well, and they may just be exposed to a third of what the other person was and have more clinical effect. Number 4 is cardiometabolic health. This includes looking at the metabolic parameters like we do in conventional medicine, looking at your cholesterol, your sugars, your blood pressure. However, with sugars, before you get to diabetes and even pre-diabetes, we look at something called insulin resistance. Insulin resistance is the first step before you're even pre-diabetic that can indicate that you are starting to have what we call metabolic dysfunction. And if you have metabolic dysfunction, it can set you up for all kinds of things like fatty liver, cardiovascular disease, strokes, and many more. Catching this metabolic dysfunction at an earlier time before you're pre-diabetic or diabetic may be more beneficial to prevent some of those effects that can happen. I don't just check A1C, I will check insulin level to see if your body is starting to have problems processing sugars, because you can have a normal A1C, but if your body is making high levels of insulin, that's going to still control your blood sugar, but the insulin is causing inflammation and setting you up for chronic disease later on. We will even check a more advanced cholesterol panel if you're at high risk, because two people can have the same LDL, but one might be at higher risk versus the other based on further deep dive into their cholesterol and their cholesterol particles. And if you want to know more about that, I do have a video on my YouTube channel about other cholesterol tests. We may look at other cardiovascular risk markers that help us assess your risk. And this helps me determine how aggressive I should be in treating someone. When you catch the metabolic parameters early, then there's a chance that you can help prevent complications from it. Number 5 is hormone balance. I'm not just talking about estrogen and testosterone. Those are important, and we might have other testing that we can do to look at that, but we look at it differently because we also look at the adrenals and how the adrenal glands can affect your other hormones, because stress is a very big problem. I'm prone to it, but stress can really cause a lot of problems with your other hormones. We may look at that to see if there's anything we can do to help balance that in addition to balancing your other hormones. We also might look at a more expanded thyroid panel. And the reason I do it is not to justify adding or putting you on higher doses of medicine, but to see if there is a potential vitamin or nutrient deficiency that might be affecting either the production of your thyroid hormone, signaling of your thyroid hormone receptors, or conversion of your inactive thyroid hormone to its active form. We also look at insulin resistance in regards to your hormones as well, because if your insulin levels are high, that can also affect your production of certain hormones over others. And number 6 is your immune system. Is your immune system awry? Like, do you have autoimmune disease? And if you have autoimmune disease, we kind of circle back to the gut health because that's very important in regards to autoimmune disease. Do you have a lot of food sensitivity, food allergies, or just allergies in general? Do you have signs of inflammation that indicate that we need to calm your inflammation down to help things function better? And then we also look at the mental, emotional, and psychological health because you can't separate your body from your mind. Your mind does play a role in how your body functions. If you've had any history of trauma, the trauma can get stored in the body if you haven't processed it and lead to chronic disease in the future. There's more to our mind and our spiritual and mental health that plays a role in our physical health. Addressing the whole person, the body, the mind, the spirit is so important in healing. We also want to look at lifestyle factors. How many hours a night are you sleeping? And are you getting good quality sleep? Do you have sleep apnea that could be putting you at risk for insulin resistance and diabetes and dementia? What's your diet like? Nutrition plays such a huge role in how you feel and in your risk of chronic medical conditions. And it's amazing because when I tell some patients this, they are so surprised because they have been told for many years the medicine is the only way. And then also your relationships and your connections. Do you have fulfillment in your life? Do you have a sense of purpose? All of these play a role in your healing. Here's what I want to leave with you today. In the beginning, I started talking about polypharmacy, and it is a real problem, and it is a red flag that we are getting sicker at a younger age, and we need to do something about it. I believe the best medicine is a combination of functional and integrated medicine and conventional medicine. We need to have something for acute symptoms, and conventional medicine does save lives, but let's take it a step further and look at underlying root causes and taking a look at how we can help our patients heal instead of just constantly fixing them with Band-Aids. Some of the functional medicine strategies may not be doable for patients, but at least we've tried, at least we've given an effort and feeling like we serve our patients. Because I know part of my burnout that I had several years ago was because I felt like I was just a legalized drug dealer. I was just prescribing and people weren't feeling better. And they would get to the point where I had no additional tools to help them. And I felt so bad. And I dreaded seeing them on my schedule because I was like, I don't know where to go. But now I have tools that I can help people. And I have a mission to help educate patients so they know there are other options out there, to help educate providers so they can open up their mind and not just think this is woo-woo. I think the more medical providers, PAs, nurse practitioners, and doctors that go into functional medicine, the more this can be a standard and norm. And then as you, as a patient, ask for it and demand it, then maybe it'll be woven into conventional medicine. I mean, I'm already seeing things in there. When I studied for my obesity boards, they were talking about gut microbiome. They were talking about toxins and how they can disrupt your hormones and cause you to gain weight. So I have so much hope, but we need to all band together and we need to not fight each other. There's so much antagonism between conventional and functional medicine, and it shouldn't be that way. We should be working together so that we can provide the best care for patients. I don't think either one itself is 100%. Even functional medicine has its limitations. It's not the perfecta either. So why don't we take the best of all the modalities of different medical models, functional, integrative, there's lifestyle medicine, longevity medicine, and conventional medicine, and let's weave it all together. I'd love to hear what you think in the comments. Subscribe and share and help me spread awareness so we can truly change medicine. I hope you found this informative. Please subscribe and share so that you don't miss out on any future podcasts. In future episodes, we'll be diving deep into gut health, inflammation, mitochondria and energy, detox, and many other topics. And there will also be a shorter daily wellness tip and habit challenge for you to follow along every day. So by the end of the year, you will have racked up small habits that can help you feel healthy so you can reset your health and reclaim your life. And if you want to watch the video version, you can head over to my YouTube channel, Functional Medicine with Dr. Var. Thanks for listening or watching, and have a fantastic day.